The hip joint is an articulation of the head of the femur with the acetabulum of the pelvic bone. On the left, you will see the three bones that make up the pelvic hip girdle, the ilium, the pubic bone, and the ischium. And articulating with it in the acetabulum that they have formed is the head of the femur. We will go over the movements and muscles and innervation of this joint. Now, the hip joint has three axes for extension and flexion, abduction and adduction, and medial and lateral rotation of the femur. These movements will then therefore take place in three planes. On the right, as we move the pelvic bone away from the head of the femur, its ball-like surfaces allow all that ranges of movement that we've just described. Now, the sensory innervation of the hip joint is very easy if you know the muscles that move the femur at the joint. This is an aspect of Hilton's law that you might recall. The gluteal muscles are supplied by the superior and inferior gluteal nerves, while iliacus is supplied by the femoral nerve, and the adductor magnus is one of the muscles in the medial compartment of the thigh supplied by the obturator nerve. These four nerves will then send sensory fibers to the hip joint. Now, circumduction is the combined actions of all the actions that we've seen so far: flexion, extension, adduction, abduction, and medial and lateral rotation. Flexion and extension take place in the sagittal plane. Adduction and abduction are at 90 degrees and carried out in the transverse plane, and at right angles to both of those planes, medial and lateral rotation will occur in the horizontal plane. A triaxial joint is also known as a multiaxial joint or a ball and socket joint. On the left of the screen, we see the pelvis being held in a horizontal position, and this is the position held when we are in the stance phase of walking. The actions we've talked about in terms of extension or flexion, abduction or adduction, or rotation are actually the actions of gluteal muscles and the adductors of the thigh and iliopsoas. In the case of the pelvis being held horizontally, it is gluteus medius that is holding the pelvis in abduction. During the walking cycle, there are two phases, a swing phase and a stance phase. When one lower limb is in the stance phase, the opposite lower limb is in the swing phase, and vice versa. Let's have a closer look at the muscles that produce these actions at the hip joint. Gluteus maximus produces extension, iliopsoas produces flexion, abduction is by gluteus medius, and adduction is by adductor magnus, for example, and gracilis. The lateral rotation of the femur is by gluteus maximus, and medial rotation is by gluteus minimus, which is way in front of gluteus medius and gluteus maximus. Now, the psoas major and iliacus are part of the common iliopsoas tendon that inserts onto the lesser trochanter. Adductor magnus and gracilis are actually examples of muscles in the medial compartment of the thigh. Movements at the shoulder joint are similar to the movements at the hip joint. We can use this time to go over what you remember of the muscles that produce movements at the shoulder joint. What you can do in this and in the next few frames is to pause the video and take your time to read and slowly go over what you recall of the various muscles you've studied so far. We'll end with a quick look at the gluteus maximus and the inferior gluteal nerve which supplies it. Have fun learning. Thank you and goodbye.